Good afternoon, everyone. So, I will be talking on a very important topic. So, very useful, practical. So immunotherapy in allergic diseases. Of course, it is a future, as you know. So, how many are having allergic rhinitis? Because it is increasing, yeah. Because this is troublesome. It improves the effective quality. Because management is very important. Allergic disease, of course, is going to increase. So the prevalence of burden of allergic diseases are increasing worldwide. Now every second or third person is having allergy. Definitely, some allergic diseases is increasing. When infections are coming down, allergies are increasing. But so many factors we want to discuss. Air pollution, global warming, climate change are interrelated, having great impact on allergic disease. Because concrete jungle, all greenery is going, construction house, the nuclear family, congested, so all increasing. And airway allergies are the earliest onset of non-communicable environmental disease with significant psycho-socio-economic health burden. Because earliest, like diabetes, hypertension, can start late. But this allergy starts in infancy only, first year only, before first birthday. Like atopic starts. And around 30 to 40% of world population suffering from some at least one allergy. So every third person now after 10 every second, after 20-30 years everybody will have allergy, 100% I can say. 30-40 years back when UG, PG, how do you see allergy cases? Now you see every second, 30 to 40% of the world population having some allergy problem. Some mild, moderate, severe. But it irritates. Irritation irritates his life. Don't be happy. It will be irritating, itching like a. Okay? Environmental control is the main pillar for prevention, management of allergic disease. That is not in our hand. Everybody has to contribute. Society and government, world, everybody has to contribute. And if environmental control, pharmacotherapy fails, the immunotherapy is the main model of treatment, future treatment. Of course, still in infancy, neonatal period immunotherapy at present. Neonatal period, because it is a last resort. No control, environmental control, no response to pharmacotherapy, suffering like anything, his quality is affected, not able to sleep properly, not able to work, concentrate work activity. Definitely, of course, we have to give that. Atom bomb, last pill. Reason for allergy. Why allergy is increasing? Why? What is the reason? Number one, hygiene hypothesis. Because saaf suthra, hygiene hypothesis. Go on hygiene hypothesis. Because you got children less than 5 years billions to play out, get exposed to infections, there is to TH1 immunity. Otherwise you go to TH2 immunity, allergy. So COVID also, hand washing, everything, not meeting people, wearing mask, hygiene hypothesis. So hygiene hypothesis is one of the reasons for going allergy disease increasing. Earlier nuclear family, many children used to play, they get infections, diarrhea, respiratory infection, they use TH1 immunity. Less allergy. Even same family, they are staying in abroad, they are allergy. Here, of course, here also they get allergy because of nuclear family, not exposed. More cesarean section. Why? Normal delivery, when inhales, ingest vaginal flora, you will get good microbiota. Good biota. Vaginal delivery, we denied that microflora. Then you develop cesarean section. So penalty is given. Cesarean section child is going to have allergy disease. It is proven. But unfortunately, most of the even educated parents, they don't get pain. They want cesarean section. But child is given the gift, allergy disease. So cesarean section born children more prone for allergic diseases. This is proven. And nuclear family, I told you, joint family, more children, more infections, the TH1 immunity. So nuclear family, no exposure, only seeing mobile TV, no exposure, no infections, so no allergy. Urbanization, concrete jungle, urbanization, air pollution, Bangalore has to be very good now, Bangalore now. 30 years back, deep PG here, read PG here only. BFC Vanivlas, 30 years back. So here, of course, good weather. Bangalore is best city. Now see, to go one place will take 2-3 hours. So much congestion, traffic, exhaust, diesel exhaust, our vehicles. That is also one of the reasons for allergies. Not breastfeeding. Unfortunately, exclusive breastfeeding only 47% is unfortunate. Because breast milk is nectar for human being. Because it develops gut microbiota, healthy gut microbiota. If breastfed for 2 to 3 years, his gut microbiota is healthy. So I say, human milk for human being, donkey for donkey milk, buffalo milk for buffalo, animal by animal. No animal milk is other animal except human being. Do tell me any animal is other animal milk except human being. That's why it is so many diseases. One of the reasons. Not eating traditional food. You want kachra food, stored food, canned food, packaged food, all preservatives, colors, all they have developed allergies. You eat traditional food. Idli, vada, dosa, curds, traditional food will have healthy gut microbiota. Kachra, junk food, kachra, stored canned food is cause allergy. Healthy gut microbiota will be there. Because gut microbiota needs healthy food like fruits, vegetables, nuts, breast milk. Then you develop gut microbiota. So healthy food first 2-3 years very important. As you know, brain grows first 2-3 years. But gut microbiota you are neglected. That also the healthy will develop for 2-3 years. If you any unhealthy food, unnecessary antibiotic, not breastfeeding, definitely is going to cause allergy. Not exposed to animals. Of course, less than 5 years we used to play with buffalo, dog, all the animals used to go. So farm animals who spend time first to 5 preschool, then less prone for allergies. This is proven. And less outdoor play. Of course, after COVID, now nuclear family, they have mobile of TV, they are not playing, not going. If they play outside, they get some infection. So then TH1 immunity. Okay. Use of unnecessary antibiotic during infancy also one of the reason it destroys your healthy gut microbiota. These are the reasons for why allergies is increasing nowadays. These are environmental allergies. These are common allergens. These are pollens, fungus, cockroach, house dust, grass weed, pet dirt. These are the common allergens. Indoor allergen most commonly house dust mite. Pollen, of course, is an outdoor pollen, outdoor dust mite. So these are the allergens. Commonest allergen causing allergy disease. Indoor allergen mainly house dust mite, pets, cockroach, fungus. Outdoor pollens, weeds, pollens. These are common. These are allergy season. Different allergies are different allergens. Pollens. Should know pollen calendar. Different allergies are different. So source of pollution. Of course, these are the outdoor pollution, indoor pollution. Outdoor pollution, these are the because of your automobile exhaust. So many. So everybody has a car, vehicle. Everybody moving. Of course, the power plant emission, open burning solid waste, construction related work, construction going on, and mining activity of pollen, fungi, outdoor. Of course, indoor, these are antigens. Aerobiological, they are the antigens. So don't confuse the antigen and irritants. So what is these are the antigens. These are antigens. These are irritants. These are irritants. Irritant enhances antigenicity. For example, pollen is there. If diesel exhaust and increase the 40 times antigenicity of pollen. That's why diesel vehicles are worse than petrol. Of course, best is electric vehicles. So diesel vehicle is worse for allergic patient. They can increase antigenicity. So these are the allergens. Indoor, these are outdoor allergens. These are dust mite, cockroach, fungus, pets. While these are the allergens. These are the irritants like tobacco smoke, mosquito coil, cooking foil. These are perfumes, agarbatti. One mosquito coil equal to taking 100 cigarettes. One mosquito coil equal. That's why mosquito avoid. But put to net mosquito net better. Avoid mosquito breeding. That's best. So healthy allergic mask, primary prevention and encourage vaginal delivery. Because obstetrician wants they won't make money. Some people they don't want a cesarean because they don't want bear pain. But if you cesarean section, you are going to gift the allergy to your child, allergy disease. Then probiotic. Gut microbiota needs probiotic. Healthy diet first in 1 year. In pregnancy, first 1 year, first 2 years, healthy diet to improve the gut microbiota. Breastfeeding is nectar. No child denied of breastfeeding first 2 years. No child. Mother's duty, like a PG2 duty. Like you do post-graduation for 3 years. For child birth, 3 years has to spend for the child. Pregnancy, 2 years of breastfeeding, nurturing. That 3 years duties has to do for a healthy child, health microbiota. And healthy complement food. Better to eat home food, traditional food, idli, vada, dosa, curd rice. Why want you junk food, kachra food? Spending time with farm animals, spend time to get more immunity, tears for immunity. Playing with more children to get cross infection, to get tears to immunity, less allergy. Avoid unnecessary antibiotic first 2 years. That is the duty of pediatrician also. Of course, parents give an antibiotic. Of course, vitamin D supplement is. Vitamin deficiency, they are prone for allergy disease. So, like playing farm animals outside, children, they enjoy. So they get less allergy. Less allergy. Emotional bonding. So, halting allergic mass, secondary prevention. Probiotic infancy, I told you, well controlled atopic dermatitis. Atopic dermatitis is a gateway to allergy disease. Gateway to allergy disease. First start of infancy. Atopic dermatitis don't control. Allergens enter through skin, they are sensitized. Same allergen go in intestine, they are develop tolerance. That's proven. So that's why if you well controlled dermatitis, less prone for allergy disease. And avoidance of allergens and vastu house, good cross ventilation. Bedroom should expose sunlight. So dust mite to prevent growth of dust mites. And of course early use of immunotherapy. That we are going to discuss mainly. Immunotherapy can halt the allergy diseases. So these are allergen prevention strategies I told you already. Exercise, breastfeeding, probiotic, healthy diet, smoke around child. Of course avoid smoking. Of course government has banned smoking also. Grandfather smokes, child, definitely irritants. Right? Unnecessary antibiotic first 2 years very important because it can interfere, destroy the gut microbiota and dysbiosis. To develop healthy microbiota will take 3 to 6 months. Once you give antibiotic 1 week, no gut dysbiosis, then to take 3 to 6 months to develop a healthy microbiota. That's why unnecessary don't give antibiotic. Viral infection, try to avoid antibiotic. So how to identify allergen and specific IG? How to identify allergens? Number 1, history examination. Correlate with the history. Particular exposure he develops. For example, you go play in the garden, he gets sneezing cough. Most probably is pollen. Once you enter in the house at night, sleeping night, gets sneezing, coughing, then dust mite. When cats is there, cat of course very dangerous than dog. Dog is a stress buster. Dog is a stress buster. Cat is more dangerous than dog, particularly allergy. Your neighbor house cat also can get allergy to you. Allergy can stay for 1 month. So that's why dog is okay. Of course, you are very love with pets. Don't allow pets to be in your bedroom. Wash them weekly. Keep outside. Okay. So that's it. Determine how to determine allergen because allergen determines important to avoidance and immunotherapy. You don't know what immunotherapy give, how to avoid. So what allergen is called allergen is how to determine that by history examination. Number 2, in vivo test, skin prick test. Epigenetic skin prick test gold standard, with standard antigen, that is gold standard. Of course, if skin prick test cannot be done, you are not done by allergy specialist because standard allergens are not available nowadays. But definitely now has come in vivo test, serum specific IG by Immunotherapy available in the market. They are doing that specific also can be done. And of course, component resolved diagnosis. What component allergen cause allergy also important for the immunotherapy. Also, we can know predict which child is going to have tolerant, which is going to have persistent allergy, which child needs immunotherapy. Component resolved diagnosis now they have to do that. Okay, before immunotherapy. These are just have to do before immunotherapy. So, melanoma allergy is number 1. Allergen avoidance is possible. Allergen avoidance you can avoid pollens. Even pets can avoid, cockroaches can control, fungus can control, leaky pools can repair, but dust mite do not easy. Dust mite, it loves your skin, where a human being is a dust mite loves. They the bedroom, wherever human being, their skin, their natural skin only, their sleep. So dust might difficult control. So allergen avoidance is there, possible you can do, you can decrease the severe illness. Lifestyle change, I told you, lifestyle change. Play with farm animal, preschool child, play with children, traditional food you eat, vastu house. These are the lifestyle you can change. You can change easily. Avoid kachra, junk food, outside food, eat home food. Then of course pharmacotherapy. To control, pharmacotherapy for main pillar. But pharmacotherapy is a limitation. Some may have side effect, the complaints, the cost factor, they feel the no improvement. So many factors are there. Of course, last resort, no response with all everything is troubling, suffering. Then we have to give immunotherapy as a permanent. Immunotherapy is a gradual increasing immunizing process in which increasing dose of allergen antigens responsible for causing allergic symptoms are administered to the patient to induce increased tolerance to allergen when natural exposure occurs. So it is also known as hyposensitization desensitization. So enemy making a friend. Enemy cannot hug, immediately hit you. So enemy is very enemy. How to make friend? Slow, namaste, dursa, namaste. Like that. Gradually how do you make friend? Like an immunotherapy like that. Okay, right. So mechanism of immunotherapy, aim of immunotherapy is to restore tolerance to the allergen by inducing tendency to reduce specific IgE production. The mechanism of immunotherapy is complex, not fully understood. Of course, going on. This is mainly due to induction of regulated T cell which secrete interleukin 10 and transform growth factor. These are the interleukin 10. It is the main factor where they decrease allergen specific IgE, increase regulated T cell, and increase Th1 cytokine tissue. So allergy is Th2 cytokine. So decrease Th2 cytokine tissue, increase interleukin 10, increase IgE4. IgE4 also called blocking antibody for allergy. Earlier called blocking antibody. And IgE1, IgA. So these are the block your allergy diseases. And reduce activation, survival of eosinophil, basophil mast cell, decrease allergy specific IgE4 ratio. These are the mechanism of immunotherapy. Clinical immunotherapy, reduction of symptoms. After giving immunotherapy, they feel better, less pharmacotherapy necessary. This quality of life improved, less need for medication, improved quality of life, decreased allergen challenge response. If you have extra allergen, you will not get developing illness. Allergen used to play outside football, garden used to get sneezed cough. No, not getting. And prevention, new sensitization not get. That's one of the advantages of immunotherapy is if there is decreased new sensitization. There are so many allergy. If you treat one allergy also, the allergy sensitization decreases. That's what the advantage. And prevention of progression of disease, what's called halting allergic march. For example, you don't halt, atopic dermatitis go, food allergy go to your allergic rhinitis, bronchial asthma, then adult asthma, that goes like this, march. So you can halt allergy disease going to severe, particular allergic rhinitis persists throughout life, asthma persists. Allergic rhinitis is suffering like anything. You can halt it and suppression of mucus production. Indication of immunotherapy, moderate to allergic rhinitis. Allergic rhinitis, no response to pharmacotherapy, there is modality because it affects quality of life. You cannot sleep properly, sneeze like that. You don't sleep properly, next day it affects quality of life. You cannot concentrate work. And allergic kind of rubbing. And of course, allergic rhinitis, those are both are brothers. Mild to moderate persistent allergic asthma. Severe asthma usually immunotherapy can be not used, but mild to moderate asthma, no response to pharmacotherapy can be used. Of course, venom allergy, atopic dermatitis, aeroallergen. When you know aeroallergen, dust mite, pollen, you can do immunotherapy. Is recently approved. Atopic dermatitis is main gateway to allergic march. If you don't control dermatitis, you can go allergic 100%. Ideal age for immunotherapy is 5 to 50. Less than 5 years difficult because sometimes there is anaphylaxis you cannot notice. Less than 3, now doing 4-5 years also, but less than 5 years difficult. Above 55-60 difficult because they have other comorbidities. Indication immunotherapy, respiratory allergy, insufficient response to immunotherapy control, where immunotherapy cannot be done. Insufficient response to pharmacology, no response to treatment. Persistent symptoms, seasonal perennial, round the clock is suffering, significant medical therapy, and poor compliance, you cannot not using, compliance is not there. And prevention asthma, allergies, rhinitis. Rhinitis is there, you can prevent good asthma. Cost burden, cost is increased. So there is immunotherapy. Definitely immunotherapy decrease the cost of the total treatment. Cost. Contraindication, of course, severe asthma, severe immunological disease, immunodeficiencies, beta blocker because you give sometimes anaphylaxis where adrenal doesn't work. That's why beta blocker you avoid immunotherapy. And malignancy, non-compliant patient, of course, compliance is important. Less than, I told you 3 years. Above 3 years can use oral immunotherapy, but less than 3 years should not, because side effects of immunotherapy sometimes they cannot notice. You may miss it. So acquired immunodeficiency. These are the contraindications. Goal of immunotherapy, complete some symptom. Our goal is complete to be free burden of the allergic disease. Need for medication minimal, nil. No significant side effect, no recurrent symptom even after completion of immunotherapy. So route of administration immunotherapy, subcutaneous immunotherapy. Of course, it is a gold standard. Sublingual is coming up now. Sublingual easy to administer. Nasal, they are still expectable is not that effective. Intraoral effective, but still expectable is going on. And epicutaneous also started going on. And oral also some food allergy, food immunotherapy, allergy or oral immunotherapy. These are the different routes of administering immunotherapy. Adverse effect immunotherapy, systemic reaction to occur within 1 hour as catheter has rarely anaphylaxis, very rare. And local reaction occur up to 24 hours, delayed reaction. Incidence of severe systemic reaction approximately 1 in 1 million, not very, very common one, but still have to prepare for the anaphylaxis. Keep them ready, adrenal injection, and train how to give adrenal injection also. That is very important, because once the loose patient is a lot of litigation also is not acceptable. Incidence of fatal anaphylaxis is 1 in 2 millions, very rare. But still you have to keep ready, train the patient how to use adrenaline. Sublingual immunotherapy has more incidence of local reaction. Systemic reaction is very less sublingual immunotherapy, that is effect. Common local reactions are subcutaneous immunotherapy, wheals, induration, really granuloma after 1 to 2 weeks. And common local reaction for slit or oral mucus reaction, or itching, oral mucosa, lip swelling, mucus swelling, rarely mouth ulcers. So the sublingual immunotherapy. The local reaction is there, means the antigen is working. Counsel the parent, not going to have any adverse effect. System local reaction. Tell them, dawa acha kaam kar raha. They will be happy. And give a testimony. Scheduled immunotherapy, subcutaneous immunotherapy, updosing and maintenance. Updosing consists of once weekly for 3 to 6 months usually. Updosing. To start with the lowest dose, highest dose, 1 in 1 lakh dilution, and give till he reaches tolerance 1 in 10. So Dushman become dosed. First 1 in 1 lakh dilution, gradually increase. Once he reaction, he can go back. Once he develops some reaction, go back the dose. So he develops tolerance gradually. That's called updosing. The build-up phase. The maintenance phase has to use for 3 to 5 years. Minimum 3 years can go up to 5 years. There is no response first 1 year, you can stop. Usually clinical response starts after 3 to 6 months. You will feel better, less medication, quality of life improves. So no response after 1 year, it indicates that immunotherapy not working, or you are giving the wrong immunotherapy, wrong decision, wrong selection patient, everything is wrong there, or bad luck. So you can stop there. So after completion of course for 3 to 5 years, 80% of patients are free of disease. They are very happy. They are very happy. They go on marketing whole society. And the remaining 20%, they need minimum medication. So these are the build-up phase and maintenance phase. Same thing. Build-up phase, maintenance phase. Symptoms, go back. The symptoms come down. After build-up phase, symptoms come down. Quality improves. So what is cluster is rush schedule. They don't want to wait 3 to 6 months. That's all. Jaldi kar do humko. Jaldi kar do. Fast they want. Everything fast. The computer everything fast they want. Cluster phase they want to build up phase to about 6 weeks. Rush phase, build up phase 6 to 7 days. You have to give very frequently the chances of anaphylaxis more. Chances of reactions are. They have to consult them. Better to admit, keep in the hospital setup, give all equipment. They may chances of anaphylaxis there. Stool-efficacy allergens are very important. The concentrated aqueous extract 50% allergen is stable for 3 years. If not in glycerin, only life will be 6 months. So better to use standardized antigen, and it should be stored in a glass, 50% glacier. The stability lasts for 3 years. Selection allergens is very important. Should be standardized allergen. Earlier is to get mark company, now started getting, but standard allergens is very important to get good response. But skin prick test and immunotherapy also. So mono allergen immunotherapy is more effective. Even though sensitized for 10-20 allergens, correlate with history. What allergen? Most indoor allergen dust mite, outdoor pollen. Try to avoid allergens. Then that particular, after the component result diagnosis immunocap, you correlate with history and what antigen is causing, that you select the immunotherapy. Particularly monoallergen immunotherapy more effective than mixing multiple allergy. Mix up many allergen, sometimes enzymic degradation by protease may be there. Particularly fungus and cockroach antigen should not be mixed with allergen. If you mix it now, then protease you can destroy allergen, it will become immunotherapy become zero. That's why better to use monotherapy. Preferably, very effective immunotherapy is pollen and dust mite. Less effective cockroach fungus, very less effective. So advantage sublingual immunotherapy because less side effect, easy to administer at home, no monitoring required. Now, of course, some Reddy labs is coming up next year. Sublingual tablets, immunotherapy tablets coming up next I think few months. So that is going on. Tablet form, sublingual tablet keep for the sublingual liquid also keep. That is also coming up. So I will discuss one case. 9 years old Raghu presented to the emergency room with complaints of sneezing early in the morning, nose block. Mother says he snores during sleep, and on exam they deviated nasal septum, inflammatory hypertrophy, adenoids, tonsil hypertrophy grade 3 or 4. ENT surgeon advised immediate surgery. Usko nikalna hai. He is suffering. So adenoid tonsil has to be done. Then he came to allergy specialist, skin pet test for positive for dust mite, specific IgA positive for dust mite. So parents are advised control of dust mite, allergen avoidance, how to avoid, counsel them, started oral antihistamine and intranasal steroids were started. After 2 to 4 weeks, patient showed little response, clinical response. So what I call intranasal steroid is a medical adenotonsillectomy. It is a medical adenotonsillectomy. If you give properly intranasal steroid, you can decrease the size of adenoid. You can avoid surgery. How to proceed? Parents are still suffering, sir. What to do? This is the right patient for immunotherapy. Because dust mite is dust mite. Avoidance not improved. Best pharmacotherapy, oral antihistamine, intranasal antihistamine, and you can add intranasal antihistamine also. No response. Little response is there. The suffering is there, but the right candidate for immunotherapy. Dust mite. Dust mite is good allergen for immunotherapy. Next case, 9 years old boy presented with difficulty breathing, hypotension, loss of consciousness, diagnosed anaphylaxis. After anaphylaxis treatment is adrenaline only, and he responded. He had similar episode past. The severe developed by playing football in school. Usually symptom develop after eating food. Within 2 hours after eating food, you do some physical activity, football playing, he developed anaphylaxis. So skin prick test for wheat is positive, egg milk is negative. Specific IgA for wheat is positive and diagnosed as what is called food dependent exercise anaphylaxis. If he eats wheat, no exercise, no anaphylaxis. He does exercise without food, no anaphylaxis. But he eats food, within 2 hours he does some physical activity, develop anaphylaxis. What is called food dependent exercise anaphylaxis. So what to do next this child? Number 1, avoid, tell them don't do. Of course our culture says after food should relax. Don't do any activity. That's true also. So after food, 2 hours, don't do any physical activity. But children don't do they keep quiet. They will run, go there. So there are chances. Okay. So avoid physical activity. Number 2, if you develop anaphylaxis, train them how to go adrenaline over the leg. Such children should be preloaded adrenaline kept for 3 doses in pocket, at school, and home. Whenever develop signs, train them to give adrenaline over thigh immediately. That is only save the child. That is the drug of choice. Okay. Number, of course, last is immunotherapy. Parents want that we are ready to spend crores also. Permanent ilaaj bolo. Oral immunotherapy. Food allergy, oral immunotherapy. Not so. Immunotherapy is giving, that is the response is there. So this child can be given because wheat, nuts, peanuts, they won't develop tolerance. Like a milk can develop tolerance, 80%, 90% develop by 5-6 years they develop tolerance, milk allergy. But wheat, peanut allergy, 18-90 they persist throughout life. But immunotherapy will be effective. Third case, 13 years old Abdul diagnosed severe asthma 2 years back, sensitized to pollen, SPT, specific pollen positive. He gets more cough, sneezing when he plays in garden, and history of repeated episode of wheezing in preschool child requiring admission. Treated with inhaled corticosteroid, a long diagnostic, increasing dose, Leukotriene Montelukast has been administered for over 2 years. And persistent symptoms, asthma exacerbation, despite correct inhaled technique. Asthma means you ask them to bring technique. Sometimes inhale. Technical is important, adherence is important. There will be empty canister they will go on using. They have to check the level also. That's important. The medication is important. Allergen avoidance is important. Then the no response. International stayed for 6 months. Allergen avoidance is improved, but asthma not improved. He is suffering like anything. So what will do? This side. Of course, severe asthma, allergy, of course, comorbidity you have to see. Look for comorbidity, allergies not treated. International steroid, allergen avoidance, international steroid, beta agonistic, and also this child, of course, before immunotherapy, you have to go for anti-IG omolizumab. Anti-IG omolizumab is very effective where pharmacotherapy fails severe asthma. Anti-IG is effective, is proven. Above 6 years can be used. It is effective also. Of course, no response that immunotherapy can be given. So that's our thing. Conclusion: immunotherapy is the only modality available now to modify the pattern of disease to improve the quality of life. In future allergy disease, immunotherapy is going to stay, going on, definitely. Allergen avoidance, proper pharmacotherapy is not relieving the symptoms, then immunotherapy plays a major role. Proper selection of antigen, standard antigen, and patient is more important section of the. So selection of antigen is very important. Like your daughter marriage, you select how their boy kaisa hai, family, how is the family, he is earning well, height, weight, age, everything they check. This is also immunotherapy, you have to check. Allergen, what allergen cause, you have to confirm history, diagnosis, and skin prick test. Number 2, then standard antigen, route of administration, counsel the patient, take long term, counsel them, cost factor, adherence is important, then the response is there. If you don't do like, it's failure. That's important. So specific immunotherapy halts the atopic marks. If you start early, you can halt the atopic marks, particularly, and prevent the new sensitization. Right? Immunotherapy is the future modality of treatment for allergy disease. Future is going to be there. In Western countries they are doing. Your country infant is going to come. Next year I think sublingual immunotherapy tablets are coming really up, introducing. Okay, so that's about in short immunotherapy. Thank you. Any